Okay, so welcome everybody to this next session. And my name is Belinda Judd, if you don't know me already. And I've got multiple roles here at the Congress. I've been on the scientific co-convener role and also on the organising committee for the health stream. When I wear my other hat, I'm in work integrated learning at the University of Sydney. Thank you again for joining us. We have two fantastic presentations in this session, and they're both extremely interesting presentations around that really important topic of debriefing. So I'm glad you could join us to hear from two experts in the debriefing world and two really contrasting backgrounds and contrasting approaches. So it's going to be super exciting to hear about that. So just a reminder before we kick off the presentations, we really welcome some enthusiastic opportunity to chat and have Q&A at the conclusion of both of the sessions. The best place, I know there's multiple ways to ask a question, the best place would be to type that into the Q&A that's on the right-hand side of the WOVA app. And not using Zoom or any other sort of aspects. So please use the right-hand side question and answer section of the WOVA app, and I will collate those and facilitate the chat at the end of the two presentations. If we're all ready to go, which I think we are, it's my pleasure to introduce our first speaker. Our first speaker is Dr. Andrew Coggins, and Andrew is an emergency physician at Westmead Hospital, and he's going to talk to you about some really innovative work about debriefing, which incorporates a lot of objective metrics into it, but I'll leave it to Andrew to talk to you more. So welcome, Andrew. Thank you for joining us. We're really looking forward to your presentation.
Thanks a lot. So I'm pulling up my slides. Hopefully these will work. Pull back just for a sec. Can everyone hear me?
We can hear you. We just haven't got your slides just yet. Fantastic.
All right. So I can't see myself, but as long as you can hear and see me, that's the most important thing. So my name is Andrew Coggins. I'm an emergency physician here at Westmead Hospital, and I'd like to pay my respects to the traditional owners of the land on which I'm providing this presentation to. And it's raining outside and about 5 degrees. So I feel very at home being a Scottish person with the current climate here. And I'm going to give you a talk for the next 10 or 15 minutes about using some quantitative measures of performance for providing feedback to debriefers. Hopefully this is of interest. So if you're tuning into this talk as someone who's starting off in your debriefing journey, it might give you some tips as to how you can improve your debriefing, or maybe some ways you could analyze a video recording of your debriefing. If you're someone who's trusted with the challenging task of faculty development, this talk may help you think about alternative ways you might provide feedback to your colleagues that are learning how to debrief at all levels of learning. And if you're not in this space, hopefully there's something in this talk which might be of use to you. So all the slides for this talk are available online. And if you scan that QR code in the usual way you would check into a pub, you'll get all the slides there just on my website, emergencypedia.com/debrief, and there's plenty of other resources there on debriefing you might find interesting. So an overview of the next 12 minutes or so. So we'll talk about background about debriefing. What is debriefing? Some discussion around the existing assessment tools for measuring quality of debriefing. Those of you who have done debriefing before would be familiar with the DASH tool as well as the OSAD tool, and some people may be familiar with the SHORT tool as well, which are the three main ones that are out there and have been validated. We're going to discuss potential alternative means of measuring quality in debriefing, and I'm going to present some data from a pilot study we did in the last year or so here at Westmead. Cool.
We can't see your slides.
Okay.
Andrew, could you share again, please?
Okay, sure. Yeah, I can share. Yeah, no problem. Sorry, that's not working. You didn't miss much. I'll pull back to the last slide. Just bear with me. Is that working now?
Yes, it is.
Excellent. I'll go back to the last slide so people can get the QR code. So there's the QR code on the screen there if people wanted to get their phones out and scan the QR code. And then there's the website there. So these slides are all available online. Okay, so We can all agree debriefing is an essential skill for simulation educators, and feedback to the debriefer themselves is generally aimed at improving facilitation. One could argue that debriefing as a skill is on the spectrum of mastery learning and deliberate practice, where a cycle of learning occurs where you can improve your debriefing over time. Unfortunately, many of us observe that debriefing often gets worse with training, and we can often get stuck in the rut with overuse of certain debriefing techniques, or really just getting no feedback on our debriefing quality. However, there are tools available to help us, such as the DASH tool, but they do have some limitations. So we can all agree what debriefing is, or we often have an idea in our minds, but one would generally agree that debriefing is less about the sage on the stage and more about the guide on the side. It's a difficult skill to master, but one definition defined debriefing as a social practice during which people interact with each other, reflecting on the common experience that they've had during a scenario. This is a nice definition of debriefing. Again, we can probably think of in our heads of a picture of debriefing being less about the lecture and less about the didactic and more about the conversation. Debriefing certainly isn't intended to be a lecture of one-way information from a person providing information to an audience. It's supposed to be conversational. However, with the caveat to that would be to say, after a simulation, if a lecture is provided, learning will still occur. It's just that the learning that is occurring is likely to be at the lower level of understanding on your Miller's pyramid. It's much less likely that learning is going to be occurring at a level of team-based practice, and any innovation will be sort of killed by the didactic approach to debriefing. But I would say that learning could still occur in that scenario. So looking at the existing tools that we can consider, the first one is the DASH tool, which comes from Harvard. The second one is SHORT, which comes from France. And the third one is OSAD, which comes from Imperial College in London. And all of these tools I've used, and I find them very useful and continue to use them. They're all being validated in various different levels in the literature, and the references are there. So the DASH score is one that is probably most often used, coming from Harvard in America. And the advantage of this score is it really describes clearly what behaviors we're looking for, exemplar behaviors we're looking for in a debriefer. Reading it through, you can learn something about what debriefing looks like. The problem with it is that although this is very useful to have exemplar behaviors listed for you, there tends to be a tendency when it's used to score in a tick, tick, tick motion. How many surveys have you guys done on COVID-19 and how you're feeling about the weather? And you just tick, and you get in that rut where you just tick things. And I think these scores are really liable to this kind of regression to the mean, scoring down the middle. And I don't know, as a learner or debriefer, I don't know what a 5 means. If you give me a piece of paper with a 5 on it, I'm not sure how to get to a 6 or a 7. These kind of qualitative Likert scales are really disadvantageous when it comes to improvement over time. And the validation studies of these tools were pretty limited. For OSAD, the validation was done by the authors of the study, and it was only 2 reviewers reviewing 40 videos. And with the Harvard tool, it was people that were, students on a course on debriefing that were reviewing online videos using the DASH tool, which was great for their learning of debriefing, but it may call into question the validity of the tool being used outside of Harvard and outside of a course on debriefing. So are there alternatives? Well, it's a rhetorical question, right? I hear silence in the audience. There is alternatives. If we look back to 2009, Diekman and colleagues, Peter Diekman is from Copenhagen, but I think he's recently taken a professorship in Norway, published a paper called The Art and Science of Debriefing and Simulation, in which he described diagrams of interactions during a debriefing. So basically, the idea is that you make a diagram of the debriefer and the participants, and you map the interactions between the learner and the debriefer. When there's a strong interaction, you make a mark on the screen, and the thickness of the line between each person in the group gives an estimation of the strength of interaction during the debriefing. 10 years later, Ulmer and colleagues described this method of mapping debriefings and described that in certain Asian nations, as well as high power kind of cultures of education, which can occur in Australia as well, the debriefer is on top and the participants are below, and the information is coming directly from the debriefer to the learners. Likewise, in Scandinavian culture, Ulmer described this kind of more star-shaped pattern where there's more conversation across the group. In between, you can see a triangular pattern where one or two participants dominate the debriefing and other inactive participants talk a lot less. So we postulated we could use this along with other quantitative metrics to try to give feedback to our debriefers after their debriefing. Rather than using the DASH tool or the OSAD tool, we would give them a pictorial representation of how their debriefing was, and perhaps use that as a fulcrum to debrief the debriefer. The precedence for this actually comes from our own teaching to ourselves about using debriefing to improve outcomes. This paper by Wolf et al. In 2014 showed an improvement in outcomes in ICU settings for patient neurological outcome for cardiac arrests following a quantitative debriefing program where measures of performance in real life and simulation cardiac arrests were used to feedback to the teams, the cardiac arrest teams, in terms of their performance. So we believe this works in real life for improving clinical outcomes. We should probably postulate it could work for our debriefers improving their performance in terms of their facilitation. So just briefly, a few slides about our pilot study, and then I'm going to hand over to the next speaker, and I'm happy to take questions at the end. So using quantitative data as a feedback tool has been shown to improve performance in our learners. So the idea of this pilot study was to see whether we could use this for our debriefers to improve their performance in debriefing. So the method of this study was a small observational study in three simulation centers in 2019. And unfortunately, this convenience sample, which was aimed to be 30 debriefings, was cut short by COVID-19 lockdowns and pandemics. That's my only slide on COVID, so sorry to disappoint those of you who want to hear more about COVID. So the method was basically we did everything in real time and we did everything live. So we didn't use any videos, but we consented all the participants prior to the simulation course starting. And anyone who didn't want to consent, we basically didn't include those debriefings. But we consented the debriefers and the participants prior to the simulation, so they weren't thinking about it as they were walking into the room, and there would be less likelihood of a Hawthorne effect. We used this app called Pine Tree Watches, which you can get on your phone. And basically what we did is we started and stopped the timers to generate a map of each person in the room. So for example, participant number one, we'd start the clock when they were talking and we'd stop it when they stopped talking, and so on and so forth. So we were able to get the times for every single person in the room in terms of how long they were talking for. And we're also able to get a ratio of how long the debriefers talked for compared to how long the participants talked for. And the results were quite interesting and surprising. We also got dash scores from all the study subjects, including the observers, so the faculty developers, the debriefers, and from the participants in the various simulations. We had two faculty members. One person was measuring the times, and the other person was drawing the conversational diagrams. After the debriefing, we gave immediate feedback to the debriefers, and we asked them to score their satisfaction with the whole process of receiving feedback using these tools. So we included 12 debriefings in the study, which was less than we were hoping for, but we did get 6.5 learners per event, so plenty of learners. And there was a mixed heterogeneous sample of both debriefers and learners. There was a majority learners of junior doctors, but we had medical students and even up to consultant level nurses and doctors participating in the various debriefings. There were 7 different debriefers in the 12 debriefings, and they were both physicians and nurses with a baseline experience ranging from inexperienced to very experienced. Here's an example of some of the pictures that we generated. Case number 12 was pelvic trauma. You can see that each person's amount of time that they talked for is documented clearly and where they sat in the room. And this diagram was used in hand-drawn form to provide feedback to the debriefer. Interestingly, the ratio of 1.6 to 1 shows that the debriefers, the debriefer and the co-debriefer together talked 1.6 times more than the participants, which I guess is concerning. 9 of the 12 cases that we observed had this type of pattern where there was a ratio of greater than 1 to 1 of debriefers talking more. And therein, most of those debriefs were associated with a fan-shaped pattern of the debriefer and the co-debriefer fanning out their questions and then the information coming back. There really wasn't much crosstalk between participants or disappointingly much conversation about applying to real life scenarios. There were 3 debriefings that had a ratio of less than 1:1, and these the diagrams were mixed, but basically we saw more crosstalk in these diagrams. Interestingly, the dash scores provided by participants for these 3 debriefings compared to the 9 debriefings where there was a ratio of faculty dominance were 2 minutes to go. Faculty dominance were higher than those who were, sorry, I'm going to start over. The dash scores were higher in the learners for the ratios where they talked more and the debriefers talked less. Hopefully that makes sense. Overall, there was a discrepancy in the dash scores between the ones provided by self-rating debriefers and the ones provided by the learners. The ones that were given by learners were very high, you know, on average 6.5 out of 7, which really isn't very helpful. If you're giving out dash scores to your learners and expecting them to give you some kind of discriminatory information when as your only way of feedback, that's not going to work. And we tend to probably underscore ourselves as learners, so as learner debriefers as well. We tend to be quite self-critical of the quality of our debriefing. And the other secondary outcome of interest was the usefulness of the data and feedback was rated very highly by the learner debriefers. This busy table basically just emphasizes that in more detail, that for all dash elements, the study subjects,
And have we lost Andrew there, or is that just me?
Number 12, where there was a lower score for element 5. So I'm on to my last slide. So, and then I'm going to get the next speaker to take over. So what are the future steps for this quantitative tool? Well, the next step is going to be trying to put these quantitative matrix together into a definitive tool and trying to validate that. We're working with colleagues in Stanford in near San Francisco in America on using their quantitative tool, which is a cumulative measure of the number of questions, number of statements, number of responses, and using the timing data, the conversational diagrams, and the cumulative tallies of questions, statements, and responses as an alternative to DASH and OSAD scores for measuring the quality of debriefing. And the next step is to really just validate what this means in terms of the so what, in terms of how this may be used to provide feedback to debriefers in real time. These tools are very easy to use. You literally just tick the boxes, and it doesn't take away from your observing of the debriefing as a teacher of debriefing. So hopefully this is something that you would consider doing in the future, and I look forward to publishing these with my colleagues from Stanford in the future. So look out for these in the literature. And that's the end of my talk.
Thank you so much, Andrew, and for that kind of innovative way to be looking at improving our debriefing. And I really hope that the members of the audience will be able to pop some questions in for you so we can have some good fun debate about that after the next speaker. So please pop some questions in the right-hand side of the Q&A box in Wova. Thank you again, Andrew, and we'll come back to you after we've heard the next speaker. Our next speaker is the lovely Tod Adams, and most of you might know Tod because of her roles as a senior program manager with HETI and her involvement with New South Wales Health, and also running the Rural Mobile Sim Centre. And we've had the pleasure of hearing from Tod a few times at the conference, and we can't wait to hear her next presentation. Again, keeping the section on debriefing going, but again with a very different slant about SimChat. So welcome, Tod. Thank you again for joining us, and we're looking forward to hearing from you.
Thanks, Belinda. Now I'm just going to share my screen. There we go. Before I kick off, as we gather this morning from many locations but come together in this virtual space, I'd like us just to take a moment to reflect on the meaning of place, and in doing so recognise the various traditional owners on the land on which we are learning and gathering today. We acknowledge the elders past, present and emerging of all of the lands we work and live on, and their ancestral spirits with gratitude and respect. We also acknowledge Aboriginal members of the community who are participating in this event today, and I'm coming to you from Yuin country on the beautiful south coast of New South Wales. So let's have a talk about SimChat and how we got to where we were going. I'll give you a bit of background. So this is a no-brainer to anyone. Debriefing is a core component of simulation of learning in the simulation education process, and it's a reflective debriefing. The evidence shows us a reflective debriefing leads to significant measurable differences in the learner's critical thinking skills. An ineffective debriefing can lead to an inadequate learning experience, which can affect future patient outcomes. The problem is not knowing how to debrief or which debriefing model to use was the biggest concern of some educators that we were working with. And poor debriefing practices can affect future outcomes. We looked at what were the barriers, and there's kind of 4 main barriers up there. You can read those. How we came to this, apart from the literature review, was we actually in 2017 employed an independent evaluation of the effectiveness of the rural simulation program and the components of it in its purpose of achieving its intended outcomes. The review included focus groups, 40 focus groups, and interviews with 145 stakeholders. A significant focus was actually placed on the experience of clinical educators in rural New South Wales. One of the aims of the process evaluation undertaken was to assess the access of rural clinical educators to simulation-based education, the key enablers and the barriers to that access. Many staff and educators working in rural New South Wales and remote New South Wales were unfamiliar with simulation-based education, including the developing and delivering scenarios and actually using the simulation equipment. This was especially so for the newly appointed and novice educators. Since then, we've done some ethnographic interviews trying to determine the transition to being the doer of things, doctor, nurse, paramedic, to the teacher of things. And how does that transition work? And we kind of acknowledged along the way that being a good clinician didn't automatically translate in being a good educator. A little bit like being a great clinician doesn't make you a great manager. And we actually explored some of the transition processes beyond health. So we looked at railway, we interviewed NASA. How do you come from being the not quite astronaut to the teacher of astronauts? So we had a look at that process. And there was not a lot of support along the way from what we gathered. Some people were naturally born to be educators, and some people had to work a bit harder at it. It was also noted anecdotally that rural clinical educators reported the same issue of being able to effectively debrief. And the clinical educators in metropolitan areas held the similar experience to the novice clinical educator in the rural areas. So we came to the conclusion we actually needed to develop kind of a resource that was accessible to all despite your geographic location. And this product was developed looking at the novice clinical educator. So this was our problem. We're got increased use of quality simulation, which simulation-based debriefing. We use it not just necessarily after a simulation, but we use the same principles after a clinical event. There was no standardised resource for New South Wales health staff on debriefing a clinical simulation. So we've got some absolutely shining lights who debrief beautifully, and then we had examples of people who were harmed during the debriefing process and sent to the hurt locker. So, you know, the ability to perform a good debrief, not cause psychological damage or rock somebody's confidence, and actually get them to actually acknowledge the issues and come up with an intracerebral plan on how to improve in the future was the key to this. And not every learner had that experience. So we thought about developing this online module on clinical debriefing. The support of the module with practical tools and scripts, and to support the novice educator during the simulation debriefing conversations. So educators new to simulation found it actually difficult to implement one or more debriefing approaches from within their toolkit. So they might know all of the different types of debriefing tools, but how do I know which one to apply at which time? And how do I know how to morph them all together and pick bits of it out depending on the audience? So whilst experienced educators can draw clearly and openly from their debriefing toolkit, the novice educator identified that they required just a little bit more support. So the SimChat model was developed by Hetty, and it's delivered by the learning management system, My Health Learning. My Health Learning was introduced to standardise the delivery of education assessment of staff, knowledge and skills across New South Wales Health. We have about 160,000 employees, and the benefit of the My Health Learning platform was that it removes the duplication of training as employees have their unique training travels with them, and their records are stored in a central database, and it can be accessed anytime, regardless of where they move across their work career. Provides an integrated e-learning platform, resulting in easier recording and reporting of user data, particularly around the collection of CPD requirements. Offers a greater sophistication in generating certification and reminding staff of the periodic statewide training requirements. And it provides managers with access to more sophisticated analytics and role-based dashboards. The module that we worked on really focused on the role of the educator in debriefing, applying elements that support a safe environment for debriefing, applying a structured approach to debriefing using a SimChat model that we developed, and techniques for questioning and listening effectively. That there is one of the, we did a video shoot for this, and this was one of the screenshots from the module. So the learners, our primary target learners were novice and intermediate educators across medicine, nursing, midwifery, allied health and paramedicine. The learner background, we acknowledge that the resource developed was aimed at educators with the novice to intermediate skills in debriefing following a simulation. And these learners possess varying levels of experience with debriefing and clinical simulation. The levels of knowledge about the models of debriefing would vary significantly. These were New South Wales staff employed in a clinical education capacity, and there was a diversity in age, culture, experience, roles and literacy. Experience in clinical education and giving feedback to learners, but not necessarily the specific elements of debriefing in clinical simulation, were one of the issues that we found. The target audience were, we referred to them in the target audience as being novice to intermediate educators. The roles and responsibilities varied widely depending upon the profession. The scope of practice within the individual professions also differed. And job roles focused on this module was related particularly to clinical educators who conduct simulation across those other the craft groups that I've mentioned. The opportunity for the learners, this was around the role of the educator in clinical simulation debriefing. And we actually, in the module, provided information on how to use a SimChat template to facilitate a structured debriefing. So we wanted initially for novice educators to actually structure their debriefing and techniques for questioning and listening effectively. So the aims of the module was to contribute to increased knowledge and skills and attitudes about simulation in debriefing within New South Wales Health. We developed a subject matter expert group that guided the development of the material. The how. So we can see Ben Taylor, he's one of a FACEM that we use within our faculty for our emergency masterclass, and Steph O'Regan, who's probably very familiar to all of you. We used, and we called them talking head shots. So this was the use of expert advice and short video clips. One of the issues being a rural educator is how do you role model behaviour when you're the only one for miles around? So this provided some opportunity to share and show some role modelling, as was seen in the videos. The interactive videos provided decision points throughout the debriefing scenarios that were presented, and there was a job aid at the end, and we provided the learners with a toolbox at the end with further resources for self-directed learning. So the instructional design elements, we talked about, there was a case study based, there was expert advice that was provided, there was an interactive video, a job aid, the structured tool, which was the SimChat tool. We encouraged learner reflection and role modelling. Now, the module itself runs for about 30 to 40 minutes. It depends how much time you want to spend in there. You can spend as little or as long as you want. But if you wanted to go through all of the resources, obviously it would take a little bit longer. It was accessed via My Health Learning, and it was published in November 2019 with compliances to clinical practice, communication and relationships, standard 6 of the NSQHS Communication for Safety, and a certificate is provided at completion, and it equals 0.7 CPD hours. This is what the SimChat template looks like, and this is a printable version. And on the back of that, I'll show you on the back of that, there's an opportunity to write things. So when we look at the SimChat, we talk about setting the scene, the pre-briefing phase, the introduction to the debriefing process, and creating a safe environment. And there's a bit of a script there if you choose to use that until you become confident in being able to be authentic to yourself and putting in your own sort of text or script into that spot. So today we'll be involved in a simulation activity. The scenario will run for X minutes, after which we'll have a debriefing conversation for X minutes. So setting that scene. The introduction to the debrief. This is about how are you feeling, any initial reactions, and how do you feel after that. So what we want to do is capture the emotion straight away after that they come out of the simulation. M is make the scenario clear. Let's just be sure that we're all on the same page and we have a shared understanding of the simulation. And sometimes you might just need to paraphrase and just re-explain, this is what the case was about. Let's go through some of the facts of the case, and are we all on that same page? C is clarify the learning, explore the learning outcomes. We debrief against the learning outcomes. If there's anything that's really obvious, and we inform our learners of the learning outcomes before we go in, so there's no surprises. But if there was something that was really obvious, the elephant in the room, we do need to address it, but the reality is that we're actually exploring the learning outcomes. And there's a bit of a script there about that. Look, I was really interested in the way blah, blah happened. So I'd like to talk about da, 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 da. Can you, how did that go? Okay, so that leads you into how did that go. So after a little while, you can see how this just kind of flows into a conversation. It's a little bit clunky at first because it's somebody else's words until you make it authentic for yourself. So the how did it go? So we want to assist the learners to discuss their performance and understand it from their point of view. So the fact that we're going to understand the learner's perspectives, you can see we're starting to just weave a little bit of AI in. Don't even know that's happening yet, but that's exactly what we're doing. A is analyze and address what happened. It's exactly that. I saw this and I was curious about this. Help me understand. I'm curious to know. So link this to what you agreed were the best practices that should have happened during that scenario. And the last point is the T, the take stock and the takeaways. So I want to recapture the emotion. How did we feel at the beginning? How did we feel at the end? As a debriefer, that lets me know if I've done my job, if we've closed the loop about how you felt at the beginning, how you felt at the end. Just one word, that would be great. Don't give me a sentence, just one word, how you're feeling right now. And what are you going to take away from this simulation? We've provided them also on the back of that, there's a cognitive aid so that we can document the session, document the learning outcomes, and they can take some notes along the way. There's nothing worse than trying to debrief from memory. I can't do it. I need to take notes and I need to write down the exact words that people used in the time that it happened. I think that makes my debrief a more effective and purposeful debrief for the participants. So there's that opportunity there. Let's have a look at the evaluation outcomes. Pretty much the just right and somewhat, so the content was pretty much just right. So the big orange bits were sort of the highly, the better numbers. The content was pitched to the novice or beginner educator to simulation and based on education. As per the graph, the pitch hit the right target with 82% of respondents stating that the content was just right. So we've hit the Goldilocks point. You can see their contents was relevant to my job. Big strongly agreed again. I can make a difference in my job, up there with the strongly agree and agree. Intention to use the new skills, big on strongly agree and agree. And the course provided a thorough coverage of the subject matter, strongly agree and agree again. This was our learner feedback, which was great. This is a good for an introduction level course, but too basic for anyone who has experience debriefing. And I would totally agree with that. If you're an experienced debriefer, this is a novice level. And I'd love to see an advanced course being developed. I don't know, that may happen in the future. Good practice module, easy to incorporate into daily practice. Thoroughly enjoyed this module, best I've done in a while. Good combination of watching, reading, answering. I would like to attend a practical course to cement this knowledge and so that I could practice in a safe environment and receive feedback on my debriefing skills. I thought this module was clear and concise and a good introduction to debriefing. The videos helped in the learning experience and it was very relevant to paramedic simulation, a great tool for para-debrief. I would like to acknowledge these groups that had made the making of the e-learning module possible, and we couldn't have done it without the collaboration of the districts and the pillars. I'd also like to acknowledge the subject matter expert group and the reviews and the district heady team who were just beyond amazing with our instructional design, our graphics and video, and some resources. Thank you.
So thank you to both Andrew and Todd. I'm sure you'll agree we heard some really high quality presentations and a really lovely contrast between them as well. We do have a little bit of time for some questions, which is great. So I'll firstly send some questions Andrew's way. I know that Andrew has replied a little bit through the Wova app, but I think all of us here would like to kind of hear a little bit more from you on some of these topics. So one of the questions from Philip says, thank you, Andrew. Mapping the debrief is very helpful as debriefer feedback in my experience. Although how to avoid this becoming a unidimensional tool and how to encapsulate other favourable components of a debrief, e.g. structure, psychological safety, reflection, etc. in the feedback.
Yep. So the one part of that answer would be easy and one part is kind of harder. The non-evidence opinion part of it would be, I think, if you use your gestalt and your experience to observe those things, you can probably pick those up within your kind of quantitative tool. But I also agree with Philip's feeling, which is it could become unidimensional and it could become process driven and it could be about counting statements and questions, and that would be problematic. And I do think that using these quantitative tools would potentially have a big downside, which is you can lose a lot of those subjective qualitative elements of debriefing. For example, creating and maintaining psychological safety, using certain types of question at the appropriate time. You know, you could be using an AI. You could be, well, is it AE? I'm never really sure. Advocacy inquiry. You could be using Pendleton's model. You could be using other types of questions like circular questioning at the appropriate times. And it doesn't also capture the quality of the questions that you're using as well. And sometimes it's appropriate for the debriefer to talk longer. For example, for junior doctors versus more senior doctors, it might be more appropriate for the debriefer to lead and contribute more to the conversation. Also, it would be expected by the learners. So the simple part of it would be to say, well, I think your gestalt and your experience as a debriefing coach would probably draw out many of those elements. But I do think I would still recommend using the Dash tool to ensure that you don't lose much of the structure around the quality of the debriefing in terms of something that's understood to be an exemplar way of debriefing. So I think a combination of the quantitative tools to give a picture of what someone's doing and their behaviors in terms of their questions, in terms of how long they're talking for, versus, but also adding in the kind of qualitative tools like Dash and OSAD as a complementary thing. Here's some homework for you. Here's your Dash score. Maybe think about what you're going to change for next time is really what we need for the mastery learning. I think you need both quantitative and qualitative tools to help new debriefers improve their performance. So hopefully that answers the question. I don't think it's going to be unidimensional if it's used in the right way, but I share Philip's concerns.
And maybe like you're suggesting, a hybrid combination of the metrics with other more traditional ways is perhaps the way to go. We do have quite a few other really great questions. So Jenny asks Andrew, learners rated debriefing more highly than debriefers. Are learners looking for something different from debriefing than instructors are? And perhaps not even one single thing. And to what extent have different tool developers considered different needs?
Yeah, I mean, I've got, in that pilot, I've got more than 100 Dash paper forms, mostly from learners. And, you know, what I observed was just, and even when they were filling them out, they're just going tick, 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 tick. You know, I'm just, that's a very opinionated thing for me, but I'm just handing these to students and they're just going 7, 7, 7, 7, 7. They're not even reading the elements. So I really think with the students, they've so many evaluations to do that they end up just ticking a 7. They're like, I had a good time. That was fun. I love doing simulation, 7, 7, 7. So it's more, they're probably not rating the debriefing. They're probably rating the whole experience and they're happy. So they're going to give you a 7. What we found was the 3 debriefings with more senior learners, the Dash tool from the learners was more discriminatory, and some elements were ranked much lower. People read the tool. They took their time over reading each element. And I think that's because, you know, senior doctors don't give evaluations very often, so they probably take the time to read each of the elements. But I think for the medical students and the nursing students that did it, they're so overwhelmed by the number of evaluations they have to do every session, they just take 7, and it just gives a general feeling that they were happy. So it's not answering Jenny's question directly, but I think what we observed in the study was probably pretty simple. It was the Dash is pretty useful for senior learners, or if people take the time to score it, but it's not very useful if someone just kind of tick, tick, tick. And that's what I think probably happened. I'm happy to share with people. If people want the data, I'm happy to share the data with them if they want to look at that data, if they email me.
Awesome. Thank you so much, Andrew. So let's channel a question Todd's way. John says to you, Tod, very interesting and great way to introduce key debriefing points to novices. Any thought regarding assessing debriefing quality using SimChat within an established tool?
Great question, and that's where we're going next. So look, we wanted to demystify. So for the beginning educator, the novice, we wanted to demystify the whole debriefing thing. Everyone says it's the most important thing to do, which it is, we acknowledge that. And there's a squillion tools, and it all became pearls and, you know, diamonds and all sorts of stuff. So we just wanted to debrief it and pare it back to its absolute bare minimum. But now's our opportunity to actually try and validate this as a tool against other established tools, and then potentially use this as an assessment tool for debriefers. So that's where we're going next. So we've had some good uptake. We've had good feedback. Part of our ethnographic study is looking at the transition between the doer of things, the clinician or whatever it is that you do, to being the teacher. We actually found that there was not a lot of preparation time. Some people naturally jumped into it. Some people, it was an opportunistic role. Some people did it because they had altruistic values of wanting to educate. And some people did it really well. Some people went there because they were not in a position from a physical point of view, or there was a restructure or whatever. So there was all sorts of different reasons that people came to education, and it may not have been that they had the best skills for the position. So this was an opportunity to pare this back to the beginning, and we're looking to actually put in an ethics application and look at comparing it to other established tools, not for the senior and more advanced, as Andrew said, the Dash and the OSAD are brilliant for that, but for that novice educator to transition you into that other level of educator. Yeah, good point, thanks. And SimChat, just make it simple, just bear it back. Just, you know, we speak all sorts of fancy words, and when you're a beginner, I just want simple everyman language every day, just simple everyman language, every man woman language, just to make it easier to understand. Don't make this hard.
Yes, you're right, Tod. There has been quite a bits and pieces of feedback saying that we all love the name, and I think when we think that debriefing is a form of feedback, and feedback should be a conversation. And I think SimChat really gives the connotations of what you're trying to achieve is
but it's a two-way conversation.
Yes, absolutely.
It's not, as Andrew said, it's not the sage on the stage. It's backwards and forwards. Yeah, yes. And I'm just going to guide you. That's all, just guide, and you're going to tell me. Yeah.
Thank you, Tod. We are running out of time, although we've had some fantastic questions, but please feel free to reach out to Tod and Andrew offline to continue these conversations going. Thank you again for your attendance. I really hope you enjoyed this session on debriefing. I know I have, and we'll take a lot away from this. Next up is another session on action stations. So please feel free to pop into that, and don't forget to also check out our sponsors as well, as without them, we wouldn't be able to have this Congress. Thank you again for your attendance, and I hope you enjoyed it as well.